Right, welcome to my channel where we learn simple pathophysiologies and a lot of anatomy. So today we're going to look at lymphomas. We're going to define atherosclerosis and atherosclerosis. So what are lymphomas? Okay, now the word lymphoma means that there is neoplasms of the lymphoid tissue. The word neoplasm means new growth, new neoplasms or lymphoid tissue that is usually malignant, but in rare cases may be benign. Now, remember when we did the lymphatic system, we define the lymphatic system as that system that is responsible for collecting fluid, as there is interstitial fluid in the tissues. So as blood is taking fluid to several different parts of the body, there will be some fluids that will be seeping out of the blood vessels and remaining in the interstitium. That fluid is collected back into the bloodstream by this system known as the lymphatic system. Once this fluid has been collected from the interstitial spaces into the lymphatic vessels, it is known as a lymph fluid. Now, this lymph fluid will then pass through organs that will filter it of all foreign substances or all bacteria or microorganisms that may cause disease or might bring issues to this human being. And these organs are known as lymphoid tissue. Lymphoid tissue are several different tissues. We have several different organs. We have organs such as the spleen, okay? It is part of the lymphatic system. We have we have lymphatic tissue in the gastrointestinal tract, in the respiratory tract. We have lymphoid tissue in several organ systems of the body that help to filter out microorganisms or foreign substances in the body. Now, this lymphoid tissue may be known by different names depending on where this lymphoid tissue is. For example, we have the lymphoid tissue that is under the mucosa of gastrointestinal tract organs, and this lymphoid tissue is known as mucosa-associated lymphoid tissue. And examples of mucosa-associated tissue include things like the tonsils. So you find that these are the organs, these lymphoid tissue may be the ones that may be affected by this kind of cancer. This lymphoid tissue can also include lymph nodes that are found in different areas, for example, in the cervical region of the neck, for example, in the groin region, okay, for example, in the axillary region. So you find lymph nodes in several places, and these lymph nodes have a function of filtering blood of all the microorganisms that may be found, filtering the lymph of all the microorganisms that it may have picked up as it was in the interstitium. So lymphomas can be defined as a group of cancers in which cells of the lymphatic system become abnormal and start to grow uncontrollably. All right. And so you find that there is going to be that particular characteristic. The main cause of lymphomas is not known. Like most cancers, you find that the main cause is unknown. However, you may find that other factors may be implicated in the beginning of this condition known as lymphomas. Okay, now um, it be it begins with lymphocytes. When lymphocytes develop a genetic mutation, the mutation tells the cell to multiply rapidly. When they multiply rapidly, they result in many diseased lymphocytes. Now, lymphocytes are a group of white blood cells.
Have you lost
Okay,
your precious
so
photos for
once
years?
there is increased multiplication of these lymphocytes, you find that this patient now develops what is known as lymphomas. Now, what are classifications of lymphomas? Lymphomas can be classified into two. Okay, they can be either Hodgkin's or non-Hodgkin's lymphomas. When they are Hodgkin's lymphomas, Now, this classification is basically based on what one is able to see when you get the lymphoid tissue and you put it under the microscope. There is a classic kind of cell that is known as the Reed-Steinberg cell. Now, once this Reed-Steinberg cell is involved, is seen under the microscope, once you get this tissue and you put it under the microscope, if you're able to see the Reed-Steinberg cell, then you're going to classify this lymphoma as Hodgkin's lymphoma. On the other hand, if there is no Reed-Steinberg cell, it means that this patient has non-Hodgkin's lymphoma. So those are the two classes of lymphoma. Now, when we talk about Hodgkin lymphoma, it is a malignant disorder, and this malignant disorder is characterized by painless progressive, enlargement of the lymphoid tissue. There is going to be painless progressive enlargement of the lymphoid tissue. The presence of the Reed-Steinberg cell is due to that is the pathologic hallmark of this disorder. Okay. So how do you stage lymphomas? Like all cancers, lymphomas have a staging system. The staging system for lymphoma is known as the Ann-Arbor staging system. Now, this one is used to classify the extent of this lymphoma. It is used for both Hodgkin's and non-Hodgkin's lymphoma. And it is used to categorize the lymphoma into whether it is stage 1, stage 2, up to stage 4. Now, the bigger the number, the worse the condition is, the more advanced the condition is. So when you talk about stage 1 Hodgkin's lymphoma, when you're talking about stage 1 lymphoma, we're saying that there is involvement of a single lymph node region. Now, this single this single lymph node region could be maybe the lymph nodes of the axillary region or lymph nodes of the cervical region, a single region of lymph nodes. And stage 2 is talking about involvement of 2 or more regions on the same side of the diaphragm. So if these regions are on the same side of the diaphragm, we are saying that it is stage 2 or stage 2 lymphoma. So which means these regions should be on the same side of the diaphragm. For example, cervical region and the axillary region. Okay, and then stage 3, there is involvement of lymph node regions on both sides of the diaphragm. Okay, this may be accompanied by involvement of the spleen or by localized involvement of extra lymphatic organs or site or both. So you find that in stage 3, there is involvement of lymph nodes from both sides, on both sides of the diaphragm. So for example, if we're talking about the lymph nodes in the groin, and then you also have the involvement of lymph node in the axilla, you find that you're going to classify this as stage 3 lymphoma. Stage 4 lymphoma will involve a diffuse or disseminated involvement of 1 or more extra lymphatic organs or tissue. There'll be other organs that will be involved now. Extra lymphatic organs or tissue will be involved. Okay? This will be with or without associated lymph node involvement. So that is how you're going to classify this kind of cancer. And then what are the signs and symptoms? And so you find that the patient is going to present with fever, night sweats, or unexplained loss of 10% of or more of body weight in 6 months. All right. And then there'll be So we're saying that the signs and symptoms of lymphoma, we have the presence of fever, night sweats, unexplained unexplained weight loss of more than 10% of body weight, okay, within 6 months. Now, the presence of these symptoms above is denoted by letter B. So if a patient has these symptoms above, this is denoted by letter B. If they're absent, then we are going to denote that with the letter A. So we're saying that non-Hodgkin lymphoma may involve any lymphatic or extralymphatic tissue. So any lymphatic or extralymphatic tissue, consequently, any symptom may present. So the patient may present with painless enlargement of one or more superficial lymph nodes. Patient may present with chest pains due to enlargement of the lymph nodes of the chest, shortness of breath due to enlargement of the lymph nodes of the chest. Patient will present with swelling of the face, arms, okay, due to enlargement of the lymph nodes of the face and arms, because when there is enlargement, maybe there's even a blockage, and so you find that the fluid that is supposed to pass through those lymph nodes is not passing as well as it should. So enlarged lymph nodes in the abdomen or pelvis or an enlarged spleen may cause discomfort. Patient may start feeling abdominal fullness or bloating. Patient may lose appetite, also known as anorexia. Patient may have back pain, swelling of the legs. Okay, if there's lymphoma of the stomach, there could be abdominal discomfort, nausea, vomiting, or internal bleeding. Lymphoma of the brain, okay, may cause headaches, alteration in mental status. Patient may have seizures and weakness. Lymphoma of the skin may result in localized or extensive skin lesions, depending on where the area is, so which area is affected. The symptoms may occur due to involvement of less common sites such as bones, the testis, the spinal cord, you know. So, in the eyes and the sinuses, patients may have symptoms of anemia, all right? Patient will be feeling fatigued, shortness of breath. All those are signs of symptoms of anemia. About 20% patients with B symptoms, you find that about 20% of the people with lymphoma will present with B symptoms that we talked about, which include fever, night sweats, and weight loss. Now, how do you diagnose lymphoma? Obviously, the first thing you're going to do is a history taking. You will take a history. The second thing you're going to do is you're going to do a physical examination. You're going to examine the areas where you need to find lymph nodes, okay? And you do a full blood count, which will show you a white blood count that is high, especially the lymph nodes, the lymphocytes themselves. So there'll be a low platelet count, low HB. Bone marrow biopsy should also be done to rule out leukemia. You can do a lymph node biopsy, and this one will definitely confirm the diagnosis. And you do a lumbar puncture, which may show central nervous system involvement, chest X-ray to rule out pulmonary metastasis. Okay, and you get the history obviously from the patient, and they may tell you that maybe someone in their family has had lymphoma before. So how do you help the patient? You give cytotoxic drugs such as vincristine 2 milligrams IV OD. Okay. You can give cyclophosphamide 800 to 1,000 milligrams per kg body weight IV OD. And for inflammation, and you can give prednisolone, okay, where you begin with the high dose. The highest dose of prednisolone is 60 milligrams OD, and then you keep reducing. You keep reducing until you reach 15 milligrams, and then 10 milligrams, and then the lowest dose 5 milligrams until you stop. Okay, other forms of treatment include radiotherapy. Okay, you have to give palliative care to this patient. This patient will be in pain, and this condition may last some time, so you need to put them in the palliative care immediately the diagnosis is made. Antibiotics should be given to prevent superimposed infections. So for prophylaxis, you can give penicillin. You can give hematopoietics to correct or prevent anemia. So hematopoietics you're going to give could be folic acid, 5 to 10 milligrams OD for 14 days. You do a blood transfusion in case where there is anemia. Oh, where there is anemia, you can go give a blood transfusion. Now, for you to give the nursing care, you can look at the nursing care for leukemia, and you're going to give the same kind of nursing care even as you have this patient under palliative care. Okay, that is the simple condition of lymphoma.